Hello, I'm Tina Jennings. Now, for 35 years, Arizona hearing specialists have been helping patients hear their best so they can live their best. Dr. Janice Gash is here to tell us how. Doctor, thank you so much for coming back.
Thanks for having me.
Now, I know that especially this time of year, a lot of people will have kind of like a house full of people for the holidays. Now, if they're kind of noticing they're maybe missing out on some of the conversations and they're kind of noticing something with their hearing, how do you step in to help with that?
Well, communication is a two-way street, and also hearing loss is usually invisible. Oftentimes, family and friends will notice first that someone is not hearing or perhaps not responding well. And especially at this time of year when family is around and memories are being made, it's really our goal to help our patients identify a hearing loss and then talk with us about the different options that are available to help them hear better.
And what a great time, because even the new year is a great time to kind of have a new you.
Absolutely.
Would you say this is a good time to kind of assess that?
Yeah, I mean, you know, at this time of year, people always are making their New Year's resolutions to lose weight and exercise more, but we like to think about it in terms of looking at hearing better so that they can communicate better, have better relationships in the new year. There are so many risks of not hearing well, and I think what people also don't understand is that there are many disease processes that are also associated with hearing loss, such as diabetes, cardiovascular disease. People just think age-related hearing loss is the only thing that's important, but people that smoke, all of these things can affect your hearing, yet the benefits of hearing better lead to better communication, better cognitive functioning. Even there's been studies that talk about increased salaries and increased job performance for people who do something about their hearing loss.
Well, all great reasons to look into this. And I think maybe some people have not looked into this because maybe hearing technology and prices, they're a little confused by everything. Absolutely. And I'm sure you guys simplify that for them.
We do. Certainly part of what we do is a complete hearing evaluation, but our goal is to really match their hearing loss with their lifestyle and with their budget. And the first thing is to really choose someone who can help you with those things. And as you can see, there was a Consumer Reports article in 2009 that talked about that it does matter who you see in finding the right professional. But it's also important to know that the investment in hearing aids, which can run anywhere from several $100s to several $1,000s, certainly outweighs the risks of isolation and withdrawal, and like we just talked about, missing those memories because they didn't really hear what was being said.
And even if you have checked into this once a long time ago, there's always new technology that's always coming out that's better for you. And I know since the last time you came to visit Harris on the Blend, has there even been more advancements since then?
Yes, so one of the newest advancements is rechargeable hearing aids. And for many people, just having to deal with changing batteries has been difficult for them. The other thing is what is called a Lyric, which is an extended wear hearing aid, which fits deep into the ear. And that's actually a picture of the device, but this is actually a picture of what it looks like in the ear.
So there's nothing kind of on the outside?
There's nothing on the outside.
Interesting.
And this is wonderful for someone, who has difficulty not only changing batteries, but remembering how to put the hearing aid in their ear. Sometimes with manual dexterity, it's difficult for them.
And I know maybe even some people don't want people to be able to see that they have the hearing aid on, so that's, you know, even aesthetically, that kind of might be a point for them. Now, for 2017, looking forward, do we already know kind of where this advancements are going?
Well, I think, you know, advancements come out much more rapidly than they have in the past. We're seeing hearing aids now that can be controlled by iPhones.
Wow.
And my favorite part of that is they even have GPS device built into it. So let's say you go to a certain restaurant and you use your iPhone to set the hearing aid for that restaurant. You may need to turn up the volume a little bit or turn down the background noise. The next time you go into that restaurant, because the phone will recognize it through GPS, it'll automatically go in and make those changes for you.
That is so crazy, but that makes complete sense that it is going in that direction.
Absolutely.
So the best thing to do is, of course, get a hold of you guys and see what's the best fit. So I'm going to tell them exactly how to do that. But Doctor, thank you so much for coming again.
Thank you. Thank you.
Now, to make your appointment today, go ahead and give them a call at 399-7673. For more information, also visit ArizonaHearing.com.